So as I mentioned before, I'm a general surgeon by training and a laparoscopic surgeon by choice, I'd say. But to get there takes quite a period of time. Obviously, and the reason is you're dealing with the human body. We put a lot of premium in preserving life and fixing life. Obviously, if you're going to allow somebody to work on you or fix you, you have to make sure they've got an awful lot of training as well, and that's what the U.S. educational system does as far as surgery training is concerned. So almost everybody, in fact probably everybody who is a physician in the United States at this time has done some basic level of undergraduate education. Most have a bachelor's degree. That serves as the foundation work for getting into medical school. Only after you've passed a certain amount of exams, of course the biggest for most of all these folks is the MCAT, the Medical College Admission Test, which is a major barrier, or an obstacle I should say. There are no barriers, just obstacles. So once that's passed and you get into medical school, then you have 4 years of training, part of it which is clinical and part of it which is preclinical. There are varying levels of basic science and science training in there as well. But essentially after 4 years you graduate with an MD degree. Okay? So that's really where it only starts, because when you're in medical school at that stage you will choose your specialty. You'll decide what kind of a doctor you want to be. Most people are either medical inclined or surgically inclined. Within the medical community, of course, there's a primary care doctor, there's internal medicine physicians, rheumatologists, OB-GYNs, radiologists, and so on and so forth. And then within surgery, there's the physicians who want to actually do something with their hands to a certain degree as well. And those come in different flavors as well. There are general surgeons, there are thoracic surgeons, there are orthopedic surgeons, there are pediatric surgeons. A lot of things with surgeon after their name. So you go into a residency program after that. The usual residency program is about 5 years in clinical training. Most of us may interrupt part of that training to do some research, either a fellowship of one kind or another. That fellowship may be in clinical entities, or it may be a basic science sort of a fellowship as well. So it broadens us out to a certain degree too. It allows us to gain a better knowledge of the literature, how to deal with literature, how to design studies, how to dissect studies out, and how to read scientific papers so we can actually figure out if what we're seeing is true or not. After you finish your residency, depending on what you do after that, then you can actually, if you're crazy enough, you can choose to do some more training, and that's called a fellowship. Your fellowship is anywhere from 1 to about 3 years of very specialized training in what you want to really concentrate in. And that's kind of the progression towards being someone there. So you go essentially from undergraduate through medical school, through residency training, through fellowship training, and at the other end of it, years later, you're very poor but very, very happy. So it's a very, very, very arduous process. But nonetheless, you get to do what you love to do, which is operate.